In this video, I'm going to describe how illness has been viewed throughout history, and I'll introduce you to the biopsychosocial model of illness. First, we're going to go over how physical illness has been viewed throughout history. And what you'll notice is that people's beliefs about the causes of illness determined what people would do to try to cure the illness. And then we'll end the video with a description of the biopsychosocial model of illness. Let's start way back in the Stone Age. During this time, people thought that disease arose when evil spirits entered the head. So what do you do when there are evil spirits in your head? Well, obviously the logical treatment involved some way of getting those spirits out of your head. In fact, their treatment consisted of taking sharp tools and puncturing holes in the skull so that the evil spirits could be released. This procedure was called trepanation. And evidence of these procedures go as far back as 10,000 years, but there's a little evidence for the continuation of this practice into the Middle Ages. Here are some drawings of this sort of operation being conducted. Archaeologists have even found skulls from that time with these holes in them. Here's one skull found by archaeologists. The interesting thing about this skull is that the hole has started to heal, which means that some people actually survived these operations. Another interesting fact is that women only accounted for 10% of all trepanations, though I'm not sure historians have really determined why there was this gender difference. Okay, now moving on to the Middle Ages. In the Middle Ages, at least in the West, Christians believed disease was caused by God's punishment for some kind of evil doing. Given a different cause of illness, there was a different logical cure. Their cures tended to consist of either pilgrimages or driving out this evil in people by torturing a person. This period is also when physicians believed illness was caused by an imbalance of the body humors, or too much blood. This is when bloodletting actually began. Here's an image of a priest from the Middle Ages trying to give penance to a person in order to try to heal him of his illness. In the Renaissance, they started making great strides on the technological side of medicine, both with the discovery of microscopes and from work on autopsy. As a result of all of this advancement, medicine focused more and more on the body, so looking at organ and cell pathology as an explanation of illness. This is a Renaissance-era microscope. Starting in the mid-1700s, a popular belief was that all sickness was caused by capillary tension. They thought this simply because they had just discovered capillaries. And since the same thing caused all sickness, the same thing could cure all sickness. Bloodletting became the all-encompassing cure. It was thought that this reduced the tension in capillaries. Patients would be usually bled until they were unconscious, and this sort of therapy was used right up through the early decades of the 1800s. Here's a slide of an old map depicting the appropriate parts of the body to bloodlet from. Just take a minute to note the number of appropriate spots to bloodlet from that are on the neck and on the head. Seems kind of terrifying. Also, in case you've ever wondered why barber poles look like this, it's because barbers were the people who did the bloodletting. This is because the same tools were used in both barber shops and bloodletting. Barbers would wrap the bloody rags around a pole. Also, this pole was what the patients would hold on to encourage blood flow. The bowl on the top of the pole was meant to represent the bowl that leeches were put in while they were being used, and the bowl on the bottom of the pole represented the basin that the blood would pour into. Now keep in mind that bloodletting may look ridiculous to us now, but trepanation looked pretty ridiculous to the bloodletters. it would be pretty arrogant of us in this era to fail to realize that some of the treatments we use now will look ridiculous to future generations. Cancer treatments have been described as slash, poison, and burn, meaning that they cut the cancer out, they burn the cancer out with radiation, or they poison the tumor with chemotherapy. Those treatments are in many ways quite primitive if you think about it for a second. New treatments that they're working on now, things like altering genes in the laboratory to fight off tumors and then putting them back in the body, may very well make our current treatment look as barbaric as bloodletting and trepanation was in past generations. In the 1800s, people started noticing that patients who were untreated, that is, people who didn't receive medical care at all, such as having their blood drained until they passed out, lived longer than patients who did receive care. They realized that oftentimes the treatment was worse than the disease. In the 1800s, Oliver Wendell Holmes, a famous physician, poet, and professor, made his famous quote about medical treatments. He said, "If all the drugs could be sunk to the bottom of the sea, it would be better for mankind and all the worse for the fishes." So the response to this was about 100 years of non-invasive therapies. In these therapies, doctors simply listened, comforted, and stayed with the patient. In other words, they believed it was best to just let the illness take its natural course. This is just Oliver Wendell Holmes's quote. In the 1900s, many powerful and effective drugs were discovered, which led to the biomedical model of health and illness. In 1928, penicillin was invented, and medicine was completely changed. It was considered something of a miracle because all of a sudden a whole host of diseases could be completely cleared up using penicillin. It would basically be like if today somebody came up with a pill that could cure cancer. Here's a picture of a man with syphilis before being treated with penicillin. And here's a picture of that same man after treatment. The invention of penicillin led to a new way of thinking about illness. This is known as the biomedical model of illness. The biomedical model reduces all illnesses to organs and biochemicals in the body and suggests that every illness has a biological cause, such as organ failure. Thus, if you're sick in this way, you can go to the doctor and he'll operate on the damaged organ or give you shots or pills to fix some imbalance, chemical imbalance in your body. Or maybe you'll see the doctor when you're completely healthy and he'll give you some sort of medication to prevent you from getting some disease, maybe a polio vaccine or a flu shot. In this era, doctors were expected to cure all illnesses, and the belief was that all diseases could be cured with pharmacology, that is, with drugs, so long as the right cures could just be found. If we couldn't cure something, it was because we just hadn't found the right drug to cure something with yet. So in this era, illness is all about the body. There is no room for psychology. The body and its illnesses were considered completely separate from the mind. Physicians studied the body, and psychologists and philosophers studied the mind, and that was pretty much that. The biomedical model was hugely successful in curing and preventing a whole lot of diseases. It was absolutely ideal for the diseases that people used to die from in the early 1900s. These were acute illnesses where you caught some virus or bacterial infection that pretty much wiped you out, killing you in a matter of days or weeks. Your behavior is irrelevant to whether or not you survive these kinds of acute infectious diseases. Thus, the biomedical model was very useful in treating these acute illnesses such as tuberculosis, pneumonia, tetanus, typhus, smallpox, malaria, and polio. One well-known example of the previously devastating effects of infectious diseases is the influenza epidemic of 1918, also called the Spanish flu. It's called the Spanish flu because of increased press attention, attention it received from Spain. This was because Spain's press wasn't censored, since they weren't in World War I, unlike the press reports in Britain, America, and France. This increased press attention made it appear that Spain was especially hard hit, even though it wasn't. Also, the flu didn't even originate in Spain. Researchers actually disagree on the origin of the Spanish flu, stating numerous areas such as France, China, Austria, and even the United States, and more specifically Kansas, because of course, Kansas. The Spanish flu was the deadliest virus the world has ever known. Between September and December of 1918, more Americans died of the flu than were killed during World War I, World War II, the Vietnam War, and the Korean War combined. It killed nearly 100 million people worldwide over 2 years, though most were killed over a 6-month period. It killed more people in 24 weeks than AIDS has killed in 24 years. And more in a year than Black Death, the plague, killed in a century. Over half the dead were between the ages of 16 and 40, normally the healthiest time of life. The epidemic killed people in every part of the planet, wherever ships sailed or cars or trains traveled, but India was hit the hardest with 20 million deaths. Here's a public notice regarding the Spanish flu. If you want to pause the video now to read it, you should. It gives you some insight into how devastating this disease was and the lengths to which officials went to combat the disease. In many places, handshakes became illegal. Individuals had to wear masks made of this thin gauze when venturing outside of their homes. And because of all that misery, people were grasping for answers, for some kind of treatment or prevention. And so it isn't surprising that they clung to explanations that were purely correlational in nature. So, for example, people would hang balls of camphor around their necks. Some ate lumps of sugar flavored with kerosene. Some even believed that tying a red ribbon around their right arm could prevent the Spanish flu. Another horrible disease that used to kill a lot of people was smallpox. Aside from the Spanish flu, which was pretty much just a one-time thing, smallpox was considered the most feared infectious disease throughout history. It had been around for over 3,000 years, and it was particularly vicious. It killed over a third of all the people who were infected with it. It was thought that smallpox has changed the course of history by devastating entire cities, changing the course of battles and wars, and decimating royal families in a dozen countries. Plus, it's just a horrible disease. It puffed the skin out into thousands of little pustules that grew and hardened and merged together. They made it impossible to eat or drink or speak, but it left you completely conscious, so you were aware of what was happening, and that even if you survived this terrible disease, you'd likely be blinded or massively scarred. They tried a lot of different things to treat smallpox. They tried bloodletting, of course, purging people with laxatives, making people sweat, blistering them with chemicals or hot metal, or cooling people by wrapping them in icy cold wet bandages. They also tried cupping, which is when you put hot glasses against the skin so that they would form a vacuum as they cooled, sucking the flesh under them into welts. And none of these treatments worked. In fact, there has never been a successful treatment for smallpox. It can only be prevented with vaccines. But with vaccines, smallpox has been eradicated. The only smallpox virus that exists today are in vaults in the CDC in America and a vault in Russia. When Edward Jenner invented the first vaccine for smallpox in 1796, he didn't even know why it worked. or what the cause of smallpox was. So back then, it really did take a leap of faith to let someone inoculate you with a little pus from a milder form of smallpox sore. We'll talk about vaccines in more detail when we talk about the immune system in coming videos. But for now, just recall that the way vaccines work is by putting a little bit of the toxins from a disease into your body, which causes your immune system to create all the antibodies it needs to fight off that disease if it ever comes across it again. Of course, these treatments don't work if you don't use them. And one thing that there seems to be a backlash against these days is vaccines. Part of the backlash is because vaccines are, in some ways, too good. People never see the horrible diseases that vaccines prevent, so they don't worry about them. And instead, any small risks that might come from being vaccinated seem to be huge because you don't realize what you're avoiding by taking these small risks. Apparently, back in 2011, 18% of Americans were convinced that vaccines caused autism, and 30% weren't sure. So only a slim majority, 52%, believed that vaccines do not cause autism. But why did people ever believe vaccines cause autism in the first place? Well, when you vaccinate huge populations of children, some of whom, by pure random chance alone, are going to start showing symptoms of autism right around the time they get vaccinated. It'll make people think the vaccination caused those diseases, when all it really did was correlate with them. Autism tends to show up, and has always shown up, at the age that kids happen to get vaccinated for measles, mumps, and rubella. When your kid starts showing symptoms of autism soon after getting vaccinated, parents searching for answers start to blame this vaccination. Other parents get scared by that and decide not to vaccinate their kids, and that sets into play a dangerous chain of events in which these horrible diseases can come back. And a lot of these childhood diseases are at their highest levels in 100 years because of that. These days, it's not super uncommon to hear about measles outbreaks because of these parents' pseudoscientific beliefs. And people might think that people who refuse to get vaccinated are only endangering themselves, but that's not true. They're endangering themselves, but they're also endangering vaccinated people. That's because vaccines aren't 100% effective. To minimize your own risk, you need the people around you to also be vaccinated. So let me just sum this up and put it plainly. Vaccines do not cause autism. In fact, the only study that's ever suggested that, in even a remotely persuasive way, was found to be a deliberate fraud conducted by a researcher who was paid by a lawyer who was suing a vaccine manufacturer. Although the biomedical model was very useful in treating acute illnesses during the 1960s to 1980s, there was a gradual realization in the Western world that the biomedical model wasn't really helping people survive chronic illnesses. Chronic illnesses are illnesses that you live with. They usually involve a slow accumulation of damage. They don't generally kill you suddenly. Most of the leading causes of death today are chronic diseases. You may notice, however, that influenza is still in there. We do have a vaccine that either keeps you from getting the flu or that makes your symptoms less severe if you do get it, but it's not perfect, since the flu virus is constantly changing and it takes about 6 months to prepare the vaccine, during which time the virus continues to change. So scientists have to anticipate which virus we're going to get in order to have flu shots available in time. We don't always get it right. This slide shows you the leading causes of death in the United States and highlights how lifestyle choices are the primary driver of these causes of death. So, for example, cardiovascular disease is caused where smoking, your diet, a sedentary lifestyle can contribute to cardiovascular disease. Unintentional injuries are related to alcohol use and drug use, and so forth. A huge proportion of accidents, unintentional injuries, are related to alcohol and other drug use. The same is true with suicides and homicides. Deaths from unintentional injuries break down the following way. After the big three of car accidents, poisoning, and falls, it's mainly suicide and homicide causing these deaths, with suicide being more common than homicide. The largest source of unintentional injury is car accidents, and these days the most dangerous thing that people can do in their cars other than drink is to text. Research shows that texting while driving impairs you just as much as being legally drunk. Statistics suggest that texting while driving is responsible for 2,600 deaths per year. You can open your notes for this video and copy and paste this address into your web browser if you want to try a texting and driving simulator to see how well you will do. Odds are you won't do very well. So to deal with these chronic diseases, you need something that takes into account more than just physiological symptoms. And that's how a new model of illness was developed. And this new model of illness includes psychology. It's called the Biopsychosocial model of illness, which takes into account 3 factors that contribute to health. The first factor is biological factors, things like organs, tissues, cells, and biochemicals. The biopsychosocial model doesn't throw the biomedical model out altogether, it just adds things to it. The second factor is psychological factors, so individual emotions, behaviors, beliefs, and motivations. The biopsychosocial model realizes that these things affect whether or not you get sick and whether or not you get well. And the third and final factor are social factors, things like society, culture, community, family, and social class. One of the people who originally argued for the biopsychosocial model was a physician named George Engel. He wrote a commonly cited paper that was published in Science in 1977, arguing that the biomedical model was insufficient and that we needed a new model of illness. It's interesting and telling that it was published in the journal Science, as that journal was most heavily invested in the biomedical model, and Science is also a very influential journal. These are the reasons George Engel gives for the need for a biopsychosocial model of illness. First, the presence of a biochemical defect indicates the potential for disease, but not the existence of disease. What this means is that the defect might not manifest into illness without certain other factors, which are not necessarily biochemical. Things like stress or certain beliefs or certain behaviors. He says that it's not uncommon for a person to have a biochemical defect but not have a disease. Compare this to the biomedical model that says if you have a biochemical defect, then you should have the disease. Second, the biomedical model ignores beliefs, and beliefs can influence what symptoms patients notice in themselves, when patients come to view themselves as sick, when others come to view them as sick, whether they seek out health care at all, and then, once they do, what symptoms they mention to a doctor. All of these things can have a large influence on the course of an illness. Third, Engel claims that things like stress, emotions, and personality factors can influence the time of onset, severity, and course of a disease. If you take any two people with the identical organ and chemical symptoms, their disease will differ in ways based on psychological and social factors. Psychological and social factors may cause one person to have a more severe outbreak of the disease or a slower course of the disease. These differences can't be explained solely with a biomedical model because the biomedical model says that if you have the same biochemical symptoms, you should have the same illness course. Fourth, treatment directed only at the biochemical abnormality doesn't necessarily restore the patient to health, even in the case of documented correction of an abnormality. Basically, you need to treat more than just the biochemical abnormality to make a person healthy again. The common example here is pain, especially back pain. Many of you may know somebody who has chronic back pain. Even when you fix the problem that started this back pain to begin with, the back pain commonly persists. Finally, behaviors matter. The behavior of the physician and the relationship between the patient and physician powerfully influence the therapeutic outcome of a treatment. Also, successful treatment often requires patients to alter their behavior. They may have to learn to take pills. They may, if they have diabetes, learn to inject themselves with insulin regularly, and so forth. This is just a graphical representation of the biopsychosocial model of illness. It shows how health is interrelated with biology, psychology, and the social world.